We've arrived at the time. I'm very excited today. This is our third webinar. As we begin today, I'd like to go over some housekeeping rules. So do please turn off your camera and mute your microphone. If you do wish to, if you have a question or anything, also please put it in the chat at any point in time. This webinar is being recorded. Access to the recording via shared link will be shared post-event, and we'll also post this on our website and on our YouTube channel as well, just in case you missed any of it. The presentations will be shared after the event as a master slide. And again, any questions you have, please do put them in the chat box. They may be addressed live during the Q&A session, or they may be unanswered, but we'll definitely get back to you afterwards. And if it's a particular speaker that you ask a question to, we'll make sure the answer comes from them. And just to note, if you want captions, please go ahead and you can click on the more on languages and speech, and where you will find an option to turn on live captions in case you want to use them. And so with that, we come to indoor air quality, public awareness and policy, the chicken versus the egg dilemma. In 2000, approximately 31% of European adults smoked regularly. By 2020, that number had fallen to around 23%, with warning labels and other public awareness campaigns credited as having greatly contributed to this reduction. Awareness was also a key public health strategy during the COVID-19 pandemic. Clearly, public awareness and awareness campaigns are a key part of any public health strategy. However, Europe has seen a 40% decline in nitrogen oxide emissions and a 25% drop in P2.5, preventing 400 premature deaths annually, largely by setting ambient air quality directives with pollution limits, such as the recently adopted directive by the Commission last week, or rather by the Council. This success is due to strong policies, not public awareness alone. This raises, though, a typical chicken versus the egg dilemma. What should come first when it comes to indoor air quality? Is it public awareness or policy, or is this just another trapdoor fallacy? To answer these questions, we must consider the following. Has the COVID-19 pandemic increased awareness of indoor air quality at the policy level? And what new policies were enacted in response? What efforts are currently underway to assess and raise public awareness of indoor air quality among European citizens? And can there be an effective regulation on IAQ without public awareness? And what is the interplay between public awareness and other effective policies? In light of these questions, the K-Health in Air and EDACI projects, both members of the IDEAL cluster, have organized the Indoor Air Quality Public Awareness and Policy, the Chicken versus the Egg Dilemma webinar, the latest in the EDACI webinar series. Joining us today, we have Mr. Martin Burmer, National Councillor of the Swiss Parliament and co-founder of the Green Liberal Party of Switzerland, Dr. Gaetano Septimo, coordinator of the National Group on Indoor Air Quality at the Istituto Superiore de Sanità, Maria Ferri, or Dr. Maria Ferri, Senior Researcher at Caviloce, and Dr. Jelena Sarec, Senior Research Associate at the Croatian Anthropological Institute. And my name is Alex Borg, and I'm a Research Associate and Project Manager at the Lisbon Council, and I have the honor of moderating this high caliber panel today. So just to go over the agenda, we'll have the introduction, and we have just completed this. So then we'll go through COVID-19, IAQ, the story of Switzerland. Then we'll look at strengthening IAQ policy insights from the Istituto Superiore de Sanità, guiding public awareness across the European continent with Dr. Maria Ferri, and empowering European citizens through awareness with Dr. Jelena Sarec. And finally, we'll head to our panel and we'll have a moment for you to ask questions to our audience. So with this, we are honored to have National Councillor Martin Burmer with us today. Mr. Burmer is a Swiss National Councillor who studied chemistry at ETH Zurich. Just one moment here. Thank you. Mr. Burmer co-founded almost 20 years ago who studied chemistry at ETH at Zurich and holds a postgraduate degree in atmospheric science. Almost 20 years ago to this date, Mr. Boomer co-founded the Swiss Green Liberal Party, now one of Switzerland's 5 major political groups. During the COVID-19 pandemic, Mr. Boomer was an early advocate for measures such as testing mass vaccines and recognizing the importance of airborne transmission as well as indoor air quality in general. Today, Mr. Boomer will share insights from this experience. And with that, the floor is yours. Please go ahead.
Thank you, Alex. So then you should see the first slide. So perhaps to start, I was in my work as in atmospheric science, I was very early then also to make measurements of the temperature, the humidity, and CO2 also in my private home. So I was aware of this topic, how important clean air is also for healthy for itself. But it was in the beginning only private. But what we know from the law, in the law, we have not bad signs. We had the Swiss Labor Act that, and in the employers does not ensure the appropriate indoor climate. So we have the laws, but it was not really, the people were not enough aware about the topic. And this general lack of awareness was a problem, I think, also in the start of the pandemic situation. So from technical side, we were aware, we had the situation clear, but nobody was aware of it. And when then COVID emerged in 2020, for me and personal about me, it was very clear that the aerosol transmission will play an important role. And there was with a lot of my colleagues in the atmospheric science, I was talking this, and for us, it was clear. And in autumn 2020, it was also on the scientific side more and more clear that COVID is airborne. But all the pushes that we made at that time on the political level or also on the task force level, Switzerland, were rejected at that point, because at this time it was very difficult because most of them are not accepting the advices of the Federal Council, mostly from IPC hospitals, and they had a different option. So that is also a problem, that medicine people are not really atmospheric science knowledge, and so therefore it was hard to understand that really this could be the big problem. So it was the hard start. So next slide, please. Then we start to organize with group of scientists, politicians from different parties and many others to discuss this topic and to make it more favorable, to prove that this is really a problem. And the first step, what we get is really that the Science Task Force in Switzerland, beginning of 21, accepted the airborne transmission of COVID also in their papers. This was a very important step also then to get on the political level. So in March 22, my colleague Melanie Mettler from Green Liberal Party and myself, we helped with help of political from other parties, we put the aerosol transmission into the COVID law. So this was the first time that in the law this was mentioned, and also that the officials had to discuss this more open. And this led at the end to the Swiss Confederation sending the measure ventilation to the cantons, that this is an important topic. So it took about a year till this was really accepted. But then this topic ventilation was more included in the cantonal ordinance and also in private segment, also in companies. So we had there, I think, a quite good success. And in February 22, it was again later, we were able to convince also the deputy head of the Federal Office of Public Health and to suggest that in a workshop that this is really that they at the end also said they recognize that COVID and also other viruses are mainly through the air and through inhaling. So it's not so you have not to make a big difference, because at the end it's aerosol are very little and droplets are a bit bigger, but it's at the end the same topic. But the aerosols, they can last a long time in the air, and this was now also accepted from the officials, and this it was a big help also that this topic is really now address it on the high level. So go to next, please. Now it's the next step will also be that in the national programs and in the Epidemic Act that we can get in with this topic that these airborne pathogens are new as a official topic in, so that in a next pandemic or other situation that this topic is addressed from beginning. And we also think that this topic will be stronger addressed in the future. The problem what I see the topic is that we have no so much data. So the most important is to get data. So we should measure more. And in the new buildings, it is an easy step to do measurements of humidity, temperature, and CO2, also for the regulation of all. It's a bit more difficult in older buildings because of the costs, but there we are sure that step by step, when you do this on a pragmatic way, we can there get more data. And it's also important that the people are more aware of this topic, and they're a bit not so happy about it, because when I now go in meetings, 2 years ago in winter time, this was all in discussions. So with the air quality, to open the window, to look how is the air quality was for everybody important. Now the people forget it completely. So when what we now see is a backlash a bit, and there I think we have to work further, that at the end also with data and also with visualization, that we can make it clear to the people that this is important. Also, if we have a pandemic situation, we have every winter, we have some pandemics because we have viruses, they are going around, and therefore the clean air is one of the best possibilities to reduce the risk to spread these viruses. So to the next slide. And I think what's also very important at the end, we get also the WHO into the World Health Organization, that they really accept that the indoor airborne risk assessment in the context of COVID. I think this was a very important, because there was also long discussions that this was not really accepted. It was rejected and discussed again. But I think also this was a big success, the first WHO Europe Indoor Air Conference in Switzerland that was organized by Geneva Health Forum. And here, thanks to Anton Flo and Dr. Kluge, and also Irene Kostenas, who was doing the whole back office job and all over this topic, make this job. I think this was a start really also on the global level, on the international level, to really get this more and more active. So next. And these are some pictures. And I think this conference was also very important, because we had political persons from different parties that also saw the topic is very important. Also, they are not in the same idea how to solve the problem, but that the problem is accepted. I think this was a big success, that in all parties this topic now is addressed. Now we have to do more work, because I think really this indoor quality topic should be addressed very high, because we should at the end come to this point, as we in 100, 200 years before talked about water. Clean water is very important. If you have not clean water, you have big problems with health. And I think we should go on a certain level, that also clean air is very important for health. So can you go to the last? I would thank to a lot of people that are really working on this, because for me I'm only a little person that are a bit working in background. But I want especially here at this position again, thanks Irene Kostenas, who was always very active to push this topic, and always when I was a bit no more so motivated, she could re-motivate me to work on this topic. So thank you for attention, and I think there are possibly also some questions.
So we do have a question in the chat, which will go really quickly, because we have a question answer portion. We have one from Dr. Schutze, who actually I had met the other day, and I know they're doing some really great work. And I just want to concur with the comment. I can say how passionate Irene really is, as we've had many conversations, so I will back that up. And so, please go ahead. I would like to ask this question before, just very quickly for Martin. What is the acceptance of CO2 monitors in schools in your experience? And what had several initiatives and teachers were actually not wanting to use these? So the question is, how was it easy to get the monitors in schools? Was it an easy thing to get the monitors in schools? Were the schools willing?
It was nothing at all was easy. It was everything very, very hard work. But it was interesting that in some schools they were very open. They really want to do more, and they also they did some measurements. They did really act very offensive. And on the other hand, it was some that we had no chance to really come up to them. So this was in the pandemic time. It was really not easy topic. But what I now see that nowadays it's no more a big topic also in schools for as I feel it. I'm not very active in school situation because I have no child, but I don't see that the measurements are still really working, and therefore I think we have to work really on this topic also to see that also in a normal winter with the normal viruses, it could be very important to have a look on this indoor quality, and CO2 is the best, easiest measurement trigger to have a look on it. And I think this is accepted from almost everybody, but to do it at the end, that is the second step that a bit is missing sometimes.
Thank you very much, Mr. Wuma, for this really great intervention. And I think we all very much concur at IDIAKI that we need more evidence here. We thank you very much for your time. It was an honor to have you. And now we're moving on to Dr. Gaetano Settimo. We are honored to have him. Dr. Settimo is a senior researcher at the Istituto Superiore de Sanità with over 35 years experience in indoor air quality or air quality research as a whole. He leads the National Indoor Air Pollution Study Group at the IS, which is the Istituto Superiore de Sanità, and has contributed to numerous national and international initiatives, including advisory roles with WHO. Today, he will present his insights from the Instituto. With that, Dr. Gaetano, the floor is yours.
Good morning, and thank you for being here. My presentation is okay. My presentation.
Yes, we can see it.
Okay. The vision of my presentation.
I think we're both trying to take control. Would you like to share the presentation yourself, Gaetano?
Yes,
okay.
yes.
Okay. Please take control. Please take control.
Okay. Allora, thank you very much for the invitation in this workshop. I am an air quality researcher, and I coordinate the National Indoor Pollution Study Group of Italian National Institute of Health. The study group has produced the reference document on several topics for different pollutants, for PM10, PM2.5, the POPs, for example, dioxin, furan, and PCB documents that can be the basis for legislative Italian action. In Italy, is very important that we have non-dedicated legislation on indoor air quality. Today in Italy, when we talk about indoor air quality, we face one of the most important issues of public health. The rule of indoor air quality has never changed. We need to know the update with the definition in Italy, but in different countries, Europe, the problem for the definition indoor air quality, the environmental indoor, the norms for indoor air quality, the specific norm published International Standard Organization, and very, very difficult for the national plan or the legislation, the regulation, European and national plan. But it's very important. It is be remembered that indoor air quality is not the cherry of the cake, but is one of the main ingredients of primary prevention. And it's important to remember that for WHO, indoor air quality is the main determinant of health. It is in indoor environment that our exposure to air pollutants occurs. The magic number 19.4%. In Italy, but in different country Europe is the paradox, the air pollution and industrial occupation hygiene. In Italy, there is still a misunderstanding that we are exposed to the chemical or biological, the physical pollutant only if we use them. Unfortunately, this never happened, and must they use the values published by the WHO, valid for indoor and outdoor air. The study group collected the WHO value, the reference value or the guideline value in different country in legislation or the specific document in different European countries. The guideline WHO values that have become the basis for reference values for different countries. The WHO guideline values should be used for indoor environment. On the must remember how the indoor air quality is the central action in new national plan. The study group published the several reference document, the activity, the study group are also the reference value for the WHO. The action of the study group is very, very important action in the activity, the WHO. Thank you very much.
Thank you very much, Dr. Septimo. That was a very enlightening intervention to have there. I am uploading my presentation now. So do just bear with me, everyone. We have some questions for you later on. So this is not the end. But so if you have any questions for Dr. Septimo, please go ahead and put them in the chat. You'll have a chance to ask him, and we'll address the questions to him live. So just bear with me as the presentation, but I would like to introduce to you our next speaker on the list, who is Dr. Ferri from Caviloce. And let us get back to where we were here. And let us go forward. One moment, if you bear with me. Thank you. Ooh, I've gone too many. Whoop. Okay. Let's see. I'm having some difficulties here. Okay, let's see. Present. Perfect. Okay, so we're delighted to have with us today Dr. Maria Ferri, a senior researcher at Caviloce and a postdoctoral researcher under the Torres Quevedo program. Caviloce leads the project's work on knowledge sharing and training at the K Health in Air project, including the open access platform. Dr. Ferri also oversees tasks on social engagement, education, and awareness. Today, she will present her work on public awareness of indoor air quality throughout Europe within the remit of the K Health in Air project, our co-organizers and sponsors of today's event. Please, the floor is yours, Dr. Ferri.
Thank you very much, Alex. If you can go to the next slide, just to give you an overview, because as you know, we spend the 90% of our time indoors. So that it's inside buildings when pollutant levels are often much higher than those outside. And previous speakers has told us some of the impact of indoor air quality on health. So in order to start the activities on the K Health in Air project, we start with a survey. And in my second slide, we have some of the results of this one. Thank you, Alex. Of the results that we get from this survey on if we are aware of what is indoor air quality. And with the 78 responses across Europe, we see that almost the 70% knows the concept of has here about the concept and understand what is indoor air quality, but almost the 80% do not have access to information, or they don't know where to look for information about indoor air quality, and there is a general lack of awareness of the impact of indoor air quality. About the attitudes to indoor air quality, we see that almost the 70% of the respondents were open to pay a little more for products that improve indoor air quality at home. So there is a positive attitude towards indoor air quality, but only the half of the people that has responded take some measures to improve indoor air quality at home or at workplace. And ventilation system seems to be the more common measure at home and at workplace. So the survey that we share with the respondents was accompanied with a knowledge pill that it's aimed to raise the public awareness on the indoor air quality. Almost the 60% of the respondents committed to act and contribute to raise awareness because of reading this knowledge pill. So there is a positive attitude towards this. So having that in mind, and also the scenarios that we have, and you can see in the next slide. So we are working with 5 pilots that represent 12 scenarios, considering schools, hospitals, canteens, residents' homes from senior people, but also from students, also one market and one metro station. We are collecting data, and also our previous speaker, Martin, stressed the importance of having data. So we have installed sensors, and we are collecting data on indoor air quality, and we are combining this data with health data, with questionnaires, trying to measure mental health and quality of life of a sample of these different scenarios. And in two of the pilots, that it's Barcelona and Rotterdam, we have an in-depth analysis of health, because we are considering hospitals, so we have a cohort of patients that are more follow in the health aspect, for completing the ICOM dataset, that it's a comprehensive questionnaire on health data. And considering this kind of different profiles and also the awareness that we collect with the survey, we are implementing different social engagement activities, starting from these surveys and some materials to inform about indoor air quality. And now we are implementing in some impact mapping exercise. And if we can move to the next slide, you can see the spectrum of the activities that we plan to do following the International Association Spectrum for Public Participation framework that provides 5 different levels of participation, from starting from informing stakeholders and finishing empowering them, and that's something that we plan at the end of the project. But up to now, and all this information and all this knowledge that we are generating, we are compiling in a knowledge sharing module that we are building together with the partners of the project. And this knowledge sharing module, it's designed to be a one-stop shop for all the knowledge that we are generating, and this is existing knowledge also on indoor air quality, and address to different profiles. And we are considering 4 different profiles based on the quadruple helix of knowledge, that it's academia, but also administration, industry, and society. So all the knowledge that we are generating, we are transforming or translating to these 4 different profiles. And we have started with some knowledge pieces that are short documents with relevant knowledge that we are generating. Also, we are posting some news in plain language to make accessible the knowledge that we are generating to the all public. And we are planning to do more also some training materials in synergy with IDIAKI project. So that's here also the collaboration with them. And yeah, we are working on that. And I take the opportunity to invite all of you to subscribe our newsletter, so you can be post on the activities that we are planning. And here you have also our social networks, in which we are trying to advance on understanding what is the real impact on indoor air quality on health with evidence-based data and questionnaires that we are collecting. So thank you very much.
Thank you, Dr. Ferry, for those very enlightening words. One of the things I want to stress is about obviously the empowerment as well. It's something that's very keen to us at the IDIAKI project. And I like to say that we all under the ideal cluster, and we're stronger together with all of the data that we're getting. So we are one, even though we're separate projects, we are one group together. So with that, I'd like to introduce, and I'm proud to introduce, my dear Dr. Jana Klanas, who's a friend and colleague, a senior research associate at the Anthropological Institute for Research in Zagreb, Croatia. Dr. Saric is a key member of the IDIAKI project, where she's in charge of social impact with a PhD in human biology. Her research spans population, genetics, evolution, biology, and the effects of indoor air quality on human health, particularly in children with allergies. Today, she'll speak about empowering European citizens through awareness of indoor air quality within the remit of our beloved IDIAKI project. So with that, Yelena, the floor is yours.
Thank you, Alex. So good morning to all. Today, I will be presenting the results of the awareness campaign that we conducted within the IDIAKI project. It was a survey carried out between March and May this year within our 5 project pilots. So in the first phase, a questionnaire was designed, validated, and implemented in households within a Croatian pilot, which is focused on children with asthma, but then a shorter version was developed to facilitate wider distribution and participation. and shared with all EDIACI partners. And as you see, we received 706 responses in total, majority of them coming from Italy and Croatia, followed by Spain, Lithuania, and Estonia. So we have this geographic distribution between the north and south of Europe. This is nice. And the gender distribution in our sample was 63 females compared to 35 males. So females tend to be more, you will see from my results that they tend to be more aware, and therefore they also responded in bigger numbers to our survey. The age distribution was also bimodal in our sample. As you see, approximately half of our sample was high school students, because our Italian pilot is conducted in schools. So we had this part of the sample with an average age of 18, and the adult part of the sample with an average age of 41. So all the analysis we conducted in the general sample, but also as well as the two age-related subsamples. So interestingly, also regarding the educational background, so we have high school students, and also in the adult group, nearly 50% of our respondents had a college degree, and 25 also postgraduate degree. So this introduced a slight bias in our study, which is why we structured the data into distinct groups for subsequent analysis. And what is important to stress is that we investigated their awareness on indoor air quality based on 3 dimensions. So their knowledge, their behavior, and their attitudes, as the literature review identified these categories as the most significant. So this slide you're seeing now is on indoor air quality knowledge. So the survey showed that people tend to have more awareness of outdoor air pollution than indoor. So while people say, while 43% of participants reported having little or no knowledge on outdoor air pollution, 65% indicated the same for indoor air pollution. So this makes indoor air quality a pronounced issue that requires attention and action. Our results also show that younger participants reported significantly less knowledge, which also suggests an expected age-related difference in awareness. And when examining self-perceived knowledge across countries, 90% of respondents in Spain and 75% in Lithuania and Italy acknowledge having little knowledge on indoor air quality. The situation was slightly better in Croatia and Estonia, where only half of participants reported the same. And also, additionally, regarding knowledge, it's important to note that 1 in 4 respondents was unaware that factors like pets, furniture, and personal care products could affect indoor air quality. So this is something that should be worked on regarding awareness. Next slide, please. So the behavior of the participants showed that more than half of them take some kind of action to maintain or improve their indoor air quality. So the majority never smokes indoors, and around half of the respondents use ventilation while cooking and dust surfaces in their homes regularly. However, over half of them do not ventilate indoor spaces regularly during winter. And we know that ventilation is one of key things you can do to improve your indoor air quality. So 15% never ventilates, and 40% do it rarely. So we consider this a problem that we will address. And many also never use eco-friendly cleaning products or such products that minimize impact on indoor air. And every 4th participant reported he never maintains their air conditioners and gas boilers in their homes. So this is also quite alarming. So next slide, please. In terms of attitudes, nearly half of the participants are either unwilling to spend more on furniture and household cleaning products that are less harmful to air quality, or they have no opinion on the matter. So this is also something to be worked on. Additionally, 35% are reluctant to invest in improving air quality in their area, when compared to 25% who believe this is important. And overall, when we asked directly, they think they could do more to reduce air pollution in their homes. Around 20% feel they could do more, and they're currently not doing everything possible to minimize air pollution in their homes. So this indicates an awareness of their personal role and potential impact on the issue, but there are still 80% of people that think they have no impact. So this is also something that we have to work on to increase their awareness that they can really act, to empower them to take action with this regard. So next slide, please. What we also did, we also examined the correlation between these three key measures: knowledge, behavior, and attitudes, and factors such as gender, age, and education to identify any notable differences or trends. So the findings suggest that knowledge, behavior, and attitude together show a slight improvement with age, which is important. In terms of education, higher levels of education did not significantly enhance indoor air quality related knowledge or behavior, but there was a modest positive impact of higher education on attitudes. And lastly, women across both age groups, so in the general sample and in our age-related subsamples, consistently scored higher than men in all three areas. So in knowledge, in behavior, and attitudes related to indoor air quality. This is very important, I think, for our subsequent activities, and this is in line with previous studies that have shown that women are often more sensitive to environmental risks and tend to prioritize health-related concerns more strongly. And they also responded in bigger numbers to our survey as well. So next slide, last slide. So in conclusion, our survey identified several key gaps that really need to be addressed in our upcoming awareness campaign activities, specifically the importance of proper ventilation and regular maintenance of household equipment. The campaign should also focus more on younger populations and possibly also male population, aiming to increase their engagement in improving indoor air quality. So to tackle these gaps, we are currently updating the training materials that have been developed by our Spanish partners, as Jessica nicely pictured in the last webinar. And the revised materials will provide more information on ventilation, on impact of chemical-free cleaning products, and importance of maintaining their air conditioners, gas boilers, chimneys. And these updated materials will then be distributed in schools and libraries in forms of workshops. So this is what we think it's important to go to the community, especially to the younger population, and do something to raise their awareness. So thank you. That's all from me.
Very excited to hear the really good work that we're doing at EDIACI. Knowledge is power, and I really think that we're trying to show that. Martin, now we're moving to our panel discussion. I have one question for you that comes from actually the chat. In your experience, how can we balance, and I really like this question, how can we balance between raising awareness and preventing panic from the public? So, for example, I mean, there are some statistics that can be quite, but obviously we don't want to panic people at the same time. So how do you strike that balance, Martin?
That is a quite difficult question, but I'm sure that this can be managed, because I always said we should not make panic, but we have to have data, and to have awareness helps people to really know that indoor quality is important. When you say to people it's dangerous, I think it's the wrong communication, because it's better for you when you do a measurement, when you do open your window sometimes, and this is better for your health. It's also better for your concentration. I think you should inform people in a positive way. So I think this is normal, that you should positive communication. That's always the most important. And because to make the people afraid that the viruses are very dangerous, and if they don't make some clean air, that they will have big problems with their health, I think this will be not the right way. We are not in a pandemic situation. In a pandemic situation, I think it was a bit good to make the people more saying, hey, please be aware, because the risks are very high. They are growing within in a room of a factor of 10 or 20 when you don't ventilate enough. But I think in a normal life, you can also say when you are below the 1000 ppm, it's no problem, but you should not go over 2000 ppm. Then it's no more good also for your concentration. And I think also it's important to say it's also for your concentration. When you're sitting in a room and you have more than 2000 ppm, you cannot work concentrated for hours. So therefore, I think it's a positive communication, and this will not make the people make afraid.
I really agree on the point of positive communication. I think that is integral. I think you're going to be more effective from a policy standpoint. So thank you very much, Martin. Gaetano, could you come in, please? I do not see you. We have the next question for you. What are the key challenges in implementing effective policies for IAQ across Europe, and how can research help address these challenges?
Okay, we need to work with an organic vision that must establish a quality standard. The improvement, for example, of material characteristic, the rule of energy efficiency, and a more incisive action of primary prevention. The sample can be overcoming sectoral policies that only partially solve the IAQ problem. And on this research, is very, very important. They plays a decisive role through the results of the study activities and in sharing scientific evidence.
Thank you, Gaetano. Very interesting. I now will push us ahead to Dr. Ferry, to Maria. Maria, what role could international collaboration play in setting uniform standards and regulation for indoor air quality, or IAQ as I've shortened it? And how can Europe lead the way in fostering global awareness of indoor air quality issues?
Yeah, international collaboration in practice is crucial to set the standards and regulations for indoor air quality, and it allows to share knowledge and common guidelines and also identify best practices. So we think that Europe is in the right position to lead this kind of standards because it has this strong regulation framework. And so we have this scientific expertise, and we are committed to improve public health. So we are right now in the position to lead this process. So it's just a matter to have all the people together, so scientists, policy makers, and administrations, to have the data and to take the best informed decisions on that way.
Thank you very much, Dr. Ferry. I think that's very true, that we need to be working together. We need to be making decisions together. And with that, I will go over to my colleague and friend, very much on this line as well. How can increased awareness among the general public influence the implementation of IAQ policies at a local, regional, national, and I would add international as well, after Dr. Ferry's intervention?
Yeah, so I would say that raising awareness should start early. So I think it's very similar to preventing some health issues. So we have to work on prevention and not intervention when problems already occur. So I think as our project, our service showed that the younger population is less aware of indoor air pollution problems. So I think it's such school-based campaigns are a place to start. And when we in our project asked our participants, what is the main source of information about indoor air quality for you, that's mostly school and media. So when we talk about media, of course, that's very important because we could maybe connect to influencers and some online personalities that can make indoor air quality a trendy topic. They can create some content around indoor air quality friendly practices, like, I don't know, from home makeovers and some do-it-yourself solutions. And then this message will be spread to more people, and they can make it interesting to younger populations as well. Also, within the IAQ project, we reached out to the local newspapers and radio, and this really helped recruit more patients within our project. So this was really a key moment to increase the not only the awareness, but people really took action to get included in the project. They agreed to for us to put sensors in their homes, so they let us into their homes. So this is really something that counts.
And I've seen those photos of Violana putting up sensors and monitoring and testing all of the room. I think we have to win hearts and minds here, and I think this is a critical part. So it's a very good point. I ask our speakers, looking at the time, for the next series of questions, if you could kindly make them a bit short and sweet, as would like to obviously have a chance for all of the speakers to, or rather all to answer a lot of the questions from the audience. So with that, I return to Gaetano. Gaetano, please come in your experience. How can international collaborations, such as with the WHO, support national agencies like the Istituto Superiore de Sanità in improving indoor air quality?
Thank you for the question. It's very important the collaboration is available. Improving indoor air quality is a great team effort. WHO is a strong reference to guide and unified different prevention activity from knowledge, for example, to monitoring and in particular the risk assessment for the vulnerable population, for example, student or the workers. It's very important the meeting perché the week is the European health activity for the prevention, the action in the work in the Europe.
Thank you very much. I couldn't agree more. It's important at the European level that we're sharing information. So thank you very much for that, Gaetano. Dr. Ferry, Maria, what role do you see technology playing in monitoring and improving indoor air quality in schools, particularly in terms of accessibility and affordability for educational institutions?
Yeah, I think this is related also with the data that these sensors can collect. So if we collect data from schools and we have this data analyzed and yeah, we have this long-term data. We have also the information that the schools needs to implement strategies to improve indoor air quality inside, because they have all the data. They know which are the peaks of the day when they need to ventilate or to implement other strategies to improve indoor air quality. So the technology, and if it is accessible and affordable for them, the better. So we can have the right strategies in the right time to improve indoor air quality and to extend to improve the well-being of teachers and students attending day by day to these schools. And also, if we collect the data from this technology, we can have tailored awareness activities from schools in which we recommend the particular strategies or the moment of the day when they need to pay attention to these high peaks of poor indoor air quality. So for sure, the technology is our friend here, so we can go hand by hand to them.
Thank you so much for that. I couldn't agree more that technology can be empowering as well. Thank you very much, Dr. Ferry. And now to Yolana, the last question for the panel today. How important is it to first assess public awareness levels before launching large-scale campaigns or interventions to improve indoor air quality awareness?
Well, I would say it's very important, because by assessing the awareness levels, you will, as we did within EDIACI, identify some knowledge gaps, some misconceptions, specific areas where people lack information, and this can help you tailor the message of your campaign. So it provides a baseline, so you know where to start from. And then different groups also may have varying levels of awareness. So you can then divide your audience and customize message for each group. Also, awareness campaigns gives you information on how different people consume information. What are the main sources of sources from which they get educated? So it's through social media, through traditional media, some community organizations or other channels. So this is very important. And if you make an awareness analysis and know where the awareness is low, this allows you to prioritize certain interventions for populations that are most at risk or are at least informed.
Couldn't agree more. And we have lots of questions in the chat to get to, so I'm going to push us ahead here. I'm going to start with Dr. Septimo. Are there extensive ISO documents for indoor air quality monitoring? Will there be standards created for monitoring with low-cost sensors? And is there a document that summarizes all the ISO documents into something more understandable for people? Dr. Septimo.
Yes, it's very important the approach, the new innovative technologies for the monitoring the indoor, the environmental indoor. The problem is the application in different environment, the specific low-cost sensor. And the action for international standard organization or the European Committee is very important for the application or the elaboration of the reference document for the use the low-cost sensor in different environment indoor.
Thank you, Dr. Septimo. Okay, I'm going to push us now to Mariette, Dr. Ferry. Is there a European plan for raising public awareness for IAQ, like advertisements, games, radio programs, videos, and social media, and so on? You talked about UK Pill, which I must say is one of my favorite ideas that I've heard of, especially in terms of awareness, this idea of kind of making something digestible knowledge, which I absolutely love. So within that remit, could you give us maybe some ideas of things that you are working on?
Yeah, we are working in a platform that will be open available at the end of the project, and it is envisioned to be a one-stop shop for all the knowledge that we have generated, but also gathering external knowledge, evidence-based knowledge on indoor air quality. And we, in this platform, we combine the data that we are collecting, so we will put at the disposal of researchers, but also policymakers, the data from the sensors collected in our pilots, and also health data, of course, considering all the GDPR that it's behind. So all this kind of pool of data will be available for further research. And also we will have in this platform the knowledge sharing model that I presented in my presentation, that it's all the knowledge that we are generating addressed to these different profiles, considering the quadruple helix. So we will have these knowledge pills, but also we will have some materials that we are developing for the different profiles, also training material, raising awareness material. So all these materials will be there in an open format. And also we are designing then considering these different profiles. So if you are policymaker, you will have dedicated materials for you. If you are academia, you will have dedicated materials for you, because although the knowledge is the same for us, the way we want to communicate or the words that we are going to use are tailored to the different profiles in order to make it more understandable. So that's our plan. And happy to also receive some suggestions from the audience if they think that we can consider something that we are not in our mind inside this one-stop shop for all the knowledge on indoor air quality. We can consider it.
So just so you know, in the chat, there's the link to the K Health K pill. So please click on it. It's really exciting work that they're doing there. So please do go to that one-stop shop for learning about indoor air quality. I'm going to keep us an extra 5 minutes today. I'm sorry for having a bit of a delay, but I want to do one more question each from the audience. We won't be able to get to all of them. And now I turn to Yelana. Yelana, I wonder if, and obviously it's not from me, but this is from somebody, a member of the audience. I wonder if you have information, if those adults are parents. This is to the female participants who were the ones who are more aware. And I suppose that could also be a factor for the increased awareness of females.
Yeah, I think
I
think that's a great comment. Really gives another perspective. Unfortunately, we don't have such a question in our survey, but this is really something to consider in our upcoming activities, because parents really tend to be more aware of health risks, and they tend to think about the future more and be proactive about issues that might impact their children later in life. So yeah, thank you for this comment. We'll try to integrate this question in our subsequent surveys that we conduct.
Okay, now I'm turning back to Gaetano. Gaetano, how can the future of European regulations better address indoor air quality challenges, especially considering the progress seen with outdoor air pollution policies like the recently adopted Air Quality Act? Please, Gaetano. Gaetano, your microphone, Gaetano. I still think it's Gaetano. I still think it's.
Okay.
There you go.
It is essential a political action that puts health in the center. And it is crucial to promote raising awareness among the population. We must understand behaviors to be adopted in order to complete and make preventive action preventive action effective for the promote the health.
Haydn, avete ascoltato Sinfonia in Re maggiore o Voce nel primo, numero 86. Orchestra Sinfonica Nazionale della RAI, diretta da Yutaka Sato. Registrazione effettuata presso l'Auditorium RAI.
Thank you for that Italian intervention there.
Thank you. Okay. They support the music.
It was a sort of an advertisement to the webinar as well. No, thank you very much, Dr. Septimo. Now, heading towards back to Dr. Ferry. Dr. Ferry, is it too far-fetched to include, and I think this would have been a really good one for our last one, IAQ in school curriculums? And I'll ask that also to Yelana as well, because this is a very good question.
Yeah, maybe Yelena has more information about that, because we are right now collecting the training needs. So we will have more information in the near future. We are distributing a survey to teachers in a school, but also at the university level, because it's something that we can foster there. So I can give you more information when we have these results. So for sure, we can improve on that. But I will leave Yelena to answer.
Well, I think this question is actually similar to the one, what comes first? So public awareness or policy? So if you include something into the curriculum, this is already policy, but policies can also act as instruments for spreading awareness, also on a larger scale. For example, school curriculums already include some health education, and this is a policy-driven mechanism to improve awareness in future generations. So yeah, I think that would be good as a policy that will raise awareness with time, but I also think we can raise the awareness first and then act with some policies as well. So it goes both ways.
I thank you there, Dr. Sars, because you've taken the one question and taken it to the other as well. So now I will pose this question to Dr. Ferry and then to Dr. Septimo. So please go ahead. What should come first, public awareness or policy? Or is this just another trapdoor fallacy? Dr. Ferry, please go ahead.
Yeah, I completely agree with Gerana that both are essential and can reinforce each other. So in fact, they can work as a dynamic and interactive relationship. So public awareness can serve as a foundation for policy mobility, but policy also can come first to establish standards, guidelines, and protection of public health. So at the end, awareness inform policy and policy reinforce awareness. So they go very closely.
And Dr. Septimo, the last word is yours.
I repeat the message. Both it is essential a political action that puts health in the center. And on the other hand, it is crucial to promote raising awareness among the population. It is very difficult. The new vision is very, very, very important. The action for the project, for example, EDIACI, the health in air, for the support, the new action, political in European country.
Thank you, Dr. Septimo. So I guess the question was a trapdoor fallacy. I think there's a rounding success that they both go hand in hand and not one should come before the other. With that, we thank you all for your participation. Here is the K-Health in Air social channels. Thank you for all the insightful contributions to today's webinar. This marks not the end, but rather just the beginning in our ongoing discussion. Please keep your eye out for more upcoming webinars. The next is scheduled for December 13th. It is a Friday the 13th, most likely. And we promise it will be just as engaging. Now you will find the ideal cluster slides here. We encourage you to become a part of our vibrant community by joining the EDIACI project and the other ideal cluster projects. This is the family we fall under, and along with various other initiatives. For seamless updates and information, please send the QR codes displayed on our pages and explore the websites of the EDIACI project and ideal cluster. And with that, I would like to extend our heartfelt gratitude to our panelists for their invaluable perspectives, to you, our audience, for the engaging discussions that brought this event to life. And with that, we conclude our today's session. Until next time, stay connected, stay informed. Thank you and goodbye. Thank you, everyone.